Is my pregnancy test a false positive?
That sometimes happens if you take the test right after you had the baby. It fades within a month of having the kid.
I'm past that point.
If a guy makes a pregnancy test positive, he's at high risk of prostate cancer.
I remember hearing about that from a forum somewhere, but can women's pregnancy tests be a false positive?
There's a reason they sell pregnancy tests in 3 and 6 packs.
I thought that was to facilitate the OMG, this can be true, try another one in case this one is wrong demographic.
Are you taking fertility medications that include the hormone the pregnancy test is checking for?
If I was, I wouldn't be worried about it being a false positive.
You know the pregnancy test almost certainly has a false positive if the control strip has not changed, but the positive for the pregnancy hormones are.
That's the purpose of the control strip. What if both of them are positive?
There's a chance you're pregnant.
I don't think I am.
Then get a different test and take that. And if you think the tests are expired or bad, buy a different batch or brand from the store.
At some point, this becomes awkward.
So check the pregnancy test box to see if it is expired, and if not, it is less likely to be wrong.
It is way more likely to come up negative because you did it wrong than positive.
That's true. It will show up negative for pregnancy hormones if you don't let it sit in the pee cup long enough or mostly miss when you try to pee on the stick.
I've heard there are conditions that can cause false positives on a pregnancy test.
There are epilepsy medications that can cause it, though this is rare.
I'm not taking those.
The more common cause are hypnotic medications that can make the pregnancy test positive.
I don't see a hypnotist for meds.
They may be given by a doctor to relieve anxiety, ease muscle spasms, calm people and help them sleep.
So the medications to help relieve my anxiety may be causing this particular worry?
That's a possibility, but if you are taking those drugs, you need to talk to your doctor to get a blood test to confirm the pregnancy, and determine if you want to come off or switch meds for the sake of the kid.
Or talk to the doctor about a fast blood test to prove I'm not pregnant.
I can see the irony of the newest generation of insomnia medications causing you to stay up all night worrying if you are pregnant.
If that's the case, I could get a fast answer by stopping the sleeping pills, and after it is out of my system, testing again.
And remember that you can get a positive pregnancy test result when the embryo implants, even if it is shed by the uterine lining a couple days later in an early miscarriage.
If I see a heartbeat, then I know the test isn't the problem.
And if there isn't a baby, they can look for a tumor that makes the same hormones as a pregnancy.
And now I have a different reason to see the doctor.